So how confident should Canadians be in the planning for the vaccine rollout across Canada? Let's bring in Raywat Deonandan, an epidemiologist at the University of Ottawa, is with us again here on Primetime Politics. Good to see you again, Ray. Thanks for being with us. Appreciate it.
My pleasure.
We're still getting conflicting timelines from various political leaders about when Canadians will get vaccinated. So as you follow the debate, I mean, how confident are you that there will be a plan and that it will be effective?
I'm pretty sure there is something resembling a plan. The question is, how detailed is that plan, and has it considered all the possible ramifications? We have to consider equity issues, deployment issues, procurement, vaccine hesitancy, all these things, data infrastructure. There's an enormous amount of planning that has to go into this, and I'm pretty sure the outlines of a plan has been there for a while. It's the details that are probably lacking. And I'm not surprised that the details have not been shared to the provinces yet. I expect that a lot of that is going to be downloaded onto the provinces as well. Because each province probably has its own ethics committee to figure out how best to deploy the vaccine. And each city probably has its own task force to figure out how to procure things like trucks, storage units, stadiums, and school halls to actually have vaccination clinics and so forth.
Right.
So I'm confident, but the details have yet to manifest.
Can you explain in layman's terms why, if 4 companies now have submitted their vaccines to Health Canada, it could take well into the new year, it would seem, before the first Canadian actually gets vaccinated? Can you walk us through that process a little bit?
Sure. Well, the clinical trials are just ending now, first of all, and the Americans have a system called the Emergency Use Authorization that has 4 criteria for this rapid usage thing to happen. Number 1 is that there has to be a life and death scenario. We kind of have that. Number 2, there has to be a risk-benefit analysis for the product. That's happening. Number 3, there has to be great effectiveness demonstrated by the product. That's what they're assessing. And number 4, there have to be no alternatives. And there are no other alternatives yet. So it seems likely that they're going to get emergency use authorization for at least a couple of these products, the Moderna and Pfizer ones, in the next couple of weeks, because they seem to satisfy those criteria. When that happens, then they can start delivering product to Americans, probably sometime in the middle and end of December. Now, when do Canadians get it? In Canada, we're assessing the same data in real time. So to the extent that we can remove administrative barriers like planning for meetings, getting all the data photocopied and distributed, those kinds of things, we're doing that. All we're lacking is the last data point to be shared. And when that happens, I have confidence that the decision will be made instantaneously about whether or not that vaccine is approved for Canadians. We should be happy about this. We should be happy that we're using our own processes, our own scientists, our own values to gauge whether or not these products are suitable for us. I anticipate they will be, because there's not that much difference between our process and the American process, as far as I know. The question about when we will start getting them, that's an acquisition and procurement question. Now, that's unclear. We know that we're on the list of the top 5 countries to get product from Pfizer and Moderna. How far along on that list we are is unclear, and how long it will take for them to actually send it to us is unclear.
I guess that's one of the big questions, right? So when Moderna says Canada, look, Canada is in the front row of countries that will get the vaccine, will get some of the first batch of that vaccine when it's ready. What does it really mean?
Right. So it might just mean a couple million doses. It doesn't mean 20 million or 100 million doses. Right? We're going to need like 70 million total doses to immunize the entire country. So what we care about is, when can we get an appreciable quantity of vaccine so that we can get it to our healthcare workers and most immunocompromised and vulnerable in a reasonable timeline. Probably that means spring. We'll start getting some definitely in Q1. The question is how many, and there's no way to answer that question. What we can do in the meantime, though, is make sure that the machine is ready to accept it once the vaccine arrives. We can't control, for the most part, what happens outside of Canada. We can control what happens here. We can get the infrastructure laid out. We can get the HR laid out. We can get the cars rented and the planes rented and all that stuff. So I have faith that that stuff is being done.
Well, what about when the government says, look, details to follow once we have a Prime Minister said today, once we actually get, Health Canada approves one or more vaccines, then the full machinery of the full Health Canada infrastructure goes into into deployment mode. So getting the vaccines out, transporting them in frozen, storing them in frozen, in freezers because there's a special storage requirement, shipping them across the country in refrigerated trucks to the different provinces or on planes, however they move them about. Is that a reasonable defense of why the government isn't rolling out a detailed plan and say, look, trust us, we're ready to go? And are you satisfied by that?
Not really. There's probably some details missing that we're unaware of, maybe some negotiations happening behind closed doors I'm unaware of. It's unclear whether the excuse that we don't manufacture it, therefore we cannot control its speed of arrival, is a defensible excuse. I don't know. Many people claim that there's some lack of negotiation skill involved that put us later in the lineup than we should be. But it's one thing to point fingers backwards. I'd rather plan for what we can do in the future. So the second those vaccines arrive, do we have a plan in place for deployment? This is an endeavor unlike any other in the history of public health in Canada. It's going to require not just human resources and equipment, but planning and management wherewithal. And I keep harping on the data. The data is pretty critical here. Unlike the flu vaccine, where you can just show up to your drugstore or your doctor's office and get it, we need to keep track of who got it and when and what they got and where they got it so that we know how far along the path we are to herd immunity and when we can start lifting mitigating tools like mask wearing and distancing. So this is going to be a really complicated endeavor. I anticipate that maybe part of the planning is figuring out that data infrastructure part and who's responsible for keeping track of all of this.
Just got about 30 seconds left here. I mean, how concerned are you that a sizable number of Canadians will refuse to get vaccinated, and how any ideas on how governments and health officials can encourage compliance?
Right. So I'm not that concerned for the first few months. I think the crisis in the first few months is going to be meeting demand. We're going to get to 70% for herd immunity. We'll probably get to 50% pretty easily. I think most people kind of want this vaccine. It's that last 10 or 20% that are going to be challenging. So later in the year, I think we have to deploy our better public health education tools to convince people of the safety of this vaccine. It's going to help after it's been around for about 3 or 4 months and we see what the real safety is. I think a lot of that hesitancy will fall away. There's always going to be an intractable group that we cannot reach. That's probably okay, because again, we just need 70% or so to reach herd immunity.
All right, lots to watch for. Raywat Deonandan, always good to get your perspective. Thanks again tonight.
Thank you.